The South African Medical Association has called on its members, including healthcare workers in the private sector, to assist in hospitals where the victims of the Boksburg gas tanker explosion are receiving care. The truck carrying LPG gas exploded after the driver tried to pass under a low-lying bridge along Hospital Street in Plantation in Boksburg on Gauteng's Eastrand. The death toll from that explosion near the Tambo Memorial Hospital has now risen to 18. 9 of the deceased are Tambo Memorial Hospital staff members. About 37 patients suffered severe burn wounds and are being treated at various Gauteng hospitals. Now let's get more on this and discuss this further when I'm joined via Zoom by Denosa's provincial chairperson, Simphiwe Gada. Very good afternoon, sir. Thanks very much for joining us here on SABC News.
Afternoon, Flo, and thank you for inviting us.
You're most welcome. Yeah. All right. So the death toll from the Boksburg blast has now risen to 18. 9 out of those 18 are hospital staff, hospital members. Obviously tragic, whichever way you look at it. But let's get the reaction then from Denosa this afternoon, as of course you watch those numbers increasing, and some including your own members.
Yes, firstly, we would like to extend our deepest condolences to the nursing profession, to the families of the heroes and the heroines who passed away while they were on duty at Tambo Memorial. Well, as the Democratic Nursing Organization of South Africa in Gauteng, we are deeply disturbed by the incident that occurred. And in fact, we call for an investigation into the driver, because it is our understanding that people that are carrying out or that are transporting rather, dangerous goods have got to be assessed, and they should know the do's and don'ts on the road. But daily on our roads, we see people who are transporting either fuel, gas, driving these trucks, speeding on our roads, and not abiding by the by the prescriptions that are there in terms of safety. Yeah. So we are deeply disturbed, and as a profession, we are mourning, all our colleagues across the healthcare sector who have sadly passed on. And as an organization, what we'll also be doing is to ensure that the memory of those who have departed, because Flo, we've got, young people, some are even less than 35 years of age. They just graduated, whom we have lost into this tragic. So we need to then ensure that we preserve their legacy. Yeah. We will pursue government that at least a wall of remembrance has got to be, installed in that hospital, because these are our heroes. They did not die anyway, but they died, on duty wearing their boots. They are the soldiers of the nation.
Yeah. You speak about this wall of remembrance and passing condolences to families. What other secondary support does Denosa plan to give those families who are so impacted by what happened?
Well, tomorrow I'm going to be meeting with the team to see what other resources we can make available to assist the families. For instance, even towards the burial arrangements, because we think that the family has got to, in this instance, they don't have to bear or shoulder the responsibility, because these are our nation's heroes. So we'll see what we can get. But upon receiving all the full details, what we normally ensure happens is that the future of the children of these fallen heroes has got to be secured. So we look at all possible avenues to ensure that we give the necessary support.
Yeah. I heard you saying that, you're calling for an investigation of the driver. Incidentally, he is in fact appearing in court, we understand, tomorrow. Yes. Will you be keeping an eye on this particular case? And would you perhaps even be present or having representatives there present to keep an eye on what's happening with this particular case? Because I would imagine this would go further in terms of perhaps maybe some families choosing to prosecute privately, or whatever that the families do decide to do after this particular case. But what would you have any role as this goes on with the driver?
Well, tomorrow we will have some representatives out. We'll send our regional representatives out. And then what we'll also do, because tomorrow is just the first appearance, so we'll make sure that looking at the timing, I'm talking to you now, I'm cutting my trip short in the Eastern Cape. I'll be in Gauteng later today. So we'll make sure that in the next court appearance, because tomorrow is just for him to be charged, we ensure that there's heavy presence of health workers, but safe formations within the Gauteng province, because this is a great loss to the citizens of Gauteng, because these heroes were serving the citizens of Gauteng. So we'll keep monitoring the case very closer, because it's one of those important cases that we cannot ignore. In fact, even the company that employed this driver will also be looking deeper into them, because you might find that this is just a symptom of a bigger problem. Of course, they will always even employ a person who can just drive without the necessary qualifications. So we'll look deeper into this matter.
All right. Thanks very much for speaking to us then, Simphiwe Gada, the Denosa's provincial chairperson. Many thanks, sir. All right. That's, of course, on the back of the fact that the death toll from that tragic Boksburg blast has indeed now risen to 18, and 9 of those indeed being hospital staff.